Your face has been missing from the regular briefings. Are you on leave or something? Anyway, 33 weeks of active running up and down Nigeria and all of that. Are you on a break or what? I haven't been seeing you at the regular press briefing.
The response continues, and that's the critical thing. The institution is working very hard with all the stakeholders. We keep pushing across the country to get this outbreak under control, and that work will always continue, whether I'm at the press briefing or not. And really, what we're doing at NCC is building a strong institution that will continue supporting the country for many years to come.
I know that the NCDC is ably represented at the regular briefing, really. It's just that because I didn't see you, and I was always looking forward to seeing you every time at that briefing. Anyway, 50,964 cases, 37,569 of whom have been successfully treated. The fatality figure, a little bit down, 992. Have we done very well with our containment strategies, Dr. Iheakwazu?
So thank you. That's really at the heart of the questions we have to think about every day. And, you know, if you think about those numbers, every single day for the past 6 months, unfailingly, and the team at the Nigeria Center for Disease Control has worked hard to make sure nobody goes to bed until we provide those numbers to Nigerians. This is an incredibly difficult exercise, collating numbers from across the country, 64 labs now testing across this vast country. We check that with the state teams, the state epidemiologists, make sure that they're in sync with what the states have themselves, and go ahead and release that close to midnight every day. Saturday, Sunday, public holiday, those numbers have come out, and it's due to the hard work these guys have been doing. Now, in terms of the interpretation of those numbers, the first thing to say is, you know, when I think about some of the assumptions that were made in the beginning, early days of this outbreak, of what the trajectory could be. You know, we were really looking at projections of millions of cases millions of cases and thousands, really thousands of deaths. So yes, we still see a substantial number of cases every day, but I think that due to the collective action of many Nigerians, public health officers across the states, state governments that have risen to the challenge, we've managed to contain this outbreak at a level that is, you know, may not be where we would love to be, but really at a reasonable level, considering the nature of this virus and the struggles going out across the world. So I know that efforts are going on towards vaccines, and until we get to a vaccine, with the tools that we have at the moment, we will not be able to stop this outbreak completely. But what we'll need to do is continue managing those numbers to be low enough for us to have a fair chance of restarting our economy, restarting our way of life safely in the new normal for us to proceed. But yes, those numbers are not as bad as they could be, and not as good as they could be, but they are what they are, and we will keep working hard to keep Nigerians safe.
The second, I mean, the flip side to that question actually is, could it have been worse, really? Could it have been worse?
Oh, absolutely. Absolutely. It could have been a lot worse. And I think this is credit to the strong leadership of the federal and state government that really came together. You know, yesterday I was privileged to attend a meeting of the NEC, all the governors convened by His Excellency the Vice President that holds every month. I think this is a good example where federal government policy and state government policy has been aligned. You know, we meet regularly. We make sure that every major decision is aligned between federal and state, because, you know, you can't have, you have to be synchronous in how you're implementing this. And I think this is really credit to our leadership at the federal level, the secretary to the government of the federation who leads the presidential task force, and all the executive governors in Nigeria, because they always come together, make sure they're in sync before we come out and make any public announcements on the next steps.
All right. At the onset of this pandemic, when the whole world was in a frenzy, there were panic moves here and there. There were probably things we invested in, which today we probably didn't require. Things like ventilators and all of that. I'm sure from what we have seen across Nigeria, there has been less and less need for some of those things. In some states, treatment centers sprang up almost everywhere. Right now, some states are even closing down some of their treatment centers. are we at a stage where we need to begin to reprioritize and re-strategize and focus on new areas, particularly when we hear now, or we know for a fact, that this disease has spread to the communities and the rural areas. And these are communities and rural areas that, access to health is very minimal. These are communities where belief in this disease as well is also very poor. They actually think that when they see people wearing masks, they think it's either you are from abroad or you are from Lagos or Abuja. So are we at a stage where strategies ought to change now?
So I think that's a very important question. And the first thing to say, we started from a very low base. Whether it's the number of ventilators or the number of laboratories, in every index, we started from a low base. So whatever investments have been made in the health sector, they will not only protect us from COVID-19, but they will build up to protecting and developing our health system. So when there's another outbreak, and outbreaks are almost inevitable, the issue is how well can we respond to them? We will be in a much better position to respond. So I, as leader of the Nigeria Center for Disease Control, don't want to be counting how many labs that we've set up in the future. So those labs will serve us both for this outbreak and for everything else. But you are absolutely right, sir, in terms of changing strategy. And to be honest, we have been doing this from the beginning. But yes, we are moving literally from the skills that you need to do a sprint, a 100-meter dash, for instance, to what you need for a marathon. Because that's what this response is turning out to be. And therefore, our strategy has to change. We have to have a lot more focus on the communities, on primary healthcare, on giving people responsibility to making sure that whenever people are ill and come to hospital, they can be tested, not only to identify whether they have COVID or not, to manage them, but also to
we don't know what has gone wrong there. Let's just take a break and we'll try to reestablish connection quickly with Dr. Iheakwazu.
Every day I carry two things with me.
Yes, you were making a point before the glitch, sir.
Yeah, so I was saying, we were talking about the change of strategy.
The need to
and I was saying, yes, we have adapted this strategy literally from the beginning. And what we quickly realized after a few months, we started this response, like a sprint. Everybody was really engaged and pushing very hard. But we quickly realized that this will be a marathon. And the skills that you need for a marathon are not necessarily the same that you need for a sprint. So we will need to adapt our skills, make sure that we can persevere and continue the response over a long period of time. That includes now primary healthcare, the community, people taking personal responsibility for the response. And really that's the phase we are in now. So we're including a lot more actors from primary healthcare, health insurance, and everyone that requires the system to work. But critically, one final point on this is to restart the rest of the health sector. If you look across the indices, whether it's immunization, cancer treatment, all other aspects of health care delivery really suffered in the first half of the year. But we know people still need these health services. So what we're trying to be sure is that the Ministry of Health is working hard to ensure that all other health services are delivered safely, while we on the public health side continue to respond to the COVID-19 outbreak.
Dr. Iheakwazu, as an expert, I know that you know that COVID-19 as a public health issue, of course, the stage we're in now, brings in should bring in rather all hands on deck, state governments, local governments, and all of that. How much of this will the NCDC be driving now to bring all those other tiers of government, the subnational governments, on board to begin to play their role now that the pandemic, the sting has been taken out of the pandemic, seemingly so? Hello,
Yes. So
yeah, okay.
yes, yeah. So from the very beginning, we've always insisted from NCDC that our role is to support the states. And there, sometimes people pushed us to do more, to take over, and say, no, we've got to build the states. The states have the primary responsibility of the response. And so, of course, how much you support states really depend on how open states are to the support that you want to provide. But I'm happy that almost every single state in Nigeria has welcomed that response. They have built up their response capabilities. We actually want to see states to have mini NCDCs in their own state with a full team that is able to respond. If you imagine, most Nigerian states are larger than many African countries. So if you go to Liberia, Liberia has a national public health institute, but they have about 3 million people. Many Nigerian states are double the size of Liberia. So why don't we have a proper team of individuals that are able to prepare, detect, and respond to outbreaks at the state level? And the federal government, through the NCDC, provides them the resources, the human resources, technical expertise to do this work. And that's our vision for the country, a hub and spoke approach with the states at the middle and at the heart of it every day.
One lesson that we as a people and as a government should take away from this pandemic is that we cannot afford to neglect our healthcare facilities the way we neglected them before. It was at the onset of this pandemic that even a top government official as highly placed as the SGF said he never knew that our health situation was as bad as that. Now we know our health facilities or our health sector is bad. With all the assistance we've gotten left, right, and center, are we going to be better off moving forward? Our health health sector going to be better off? And how do we ensure that some of those things that we receive in forms of assistance don't go to waste, are not pilfered, or find their way to the markets and then find their way to the hands of commercial health centers who will then be extorting Nigerians to use those facilities that were freely given to Nigeria?
Yeah, so I am absolutely sure that there's no doubt in anyone's mind anymore about the need to invest in the health sector. The critical thing is, are we ready to walk the talk? On the side of the Nigeria Center for Disease Control, on the public health side, there's a quiet revolution happening. Every single naira we're spending, I am mindful of the fact that we have to build back better for the future. So we are quietly transforming labs, transforming treatment centers, working with states to set up emergency operation centers, working with every partner, donor, to make sure that we push resources to the state to build their systems. But remember, we work in a broader context. So this change has to happen across the sector. And I am sure my Honorable Minister of Health is working extremely hard to transform the National Health Insurance Scheme, to transform the services provided through the National Primary Healthcare Development Agency, because health security is in a way a fallout of a well-functioning health system. And in terms of health security, what we have been advocating for are the 3 S's. We need stable, sustainable, and substantial funding for health security. Because if we are not safe, if we're not healthy, the flyovers that we're building across the country, the phones, the telecoms, none of us can enjoy any of that. No other event since the Civil War has brought Nigeria to a standstill the way this pandemic has. If we don't learn any lesson from this, it's to invest in our health security. I am happy that the right investments are now coming at the national level. We need to make the right investments at the state level to build a strong health security team at all levels of government to sustain the efforts that we're making collectively. At NCDC, we're determined to build an institution that will protect the health of Nigerians, continue working on this outbreak because it's by no means over, keep working hard at it, but make sure that we have a group of people 24/7 working hard to protect the health of Nigerians, making sure that any any investments made, any budgetary allocations made are gone efficiently and deliberately to keep the country safe.
Dr. Iheakwazu, I've been pre-informed by my producer that you actually have up to 10:30 or so to spend with us. And for the last 2 minutes, I've been hearing this pom notification from your end. I hope it's not a prompt to another meeting that you are due for. Or otherwise, if you still have 2 minutes to spare us, let me just put it, okay. Let me just
I'll take one last question, yes.
one last question, sir. What is it that you think we are doing well as Nigerians that we need to continue doing? Nigerians, there's this Nigerianness in us that we are told has been able to hold this ravaging virus to ransom. The things we eat, the things we consume in terms of food, in terms of even our climate, I'm told, and then in terms of all those herbs we drink up and down. Growing up, we drink agbo as breakfast. I still do it. I can tell you that I've taken agbo this morning before I left the house. So what are those things we do as Nigerians that we should continue? And what are those things that we, in the light of the new normal, we should keep discouraging ourselves from doing?
So I'll take that question in two ways. Firstly, of all the what we call the non-pharmaceutical interventions, some of them are very hard and have really challenged our way of life. You know, our inability to hug, to dance together, to be together, to share meals in the way we used to, and that's really the essence of what makes us Nigerian, is how we can share our love in communities and families. And it's been a very painful message to give to Nigerians not to do all these things the way we're used to. So I really look forward to coming back to that. And how quickly we can come back to that really depends on how much we make these sacrifices in the short term in order to get to where we need to be. So please, I really encourage every Nigerian to not give up. I know it's been hard over the last few months, but please, let's stay at it. Let's not be tempted to let down our guards too early. Please stay on message, keep doing these important things. And back to the first part of your question, you know, there are many anecdotes of great things that work in Nigeria, in our communities, in our families, in our communities. You know, everyone has a story of some local solution. And the truth is there might be something special in those solutions, but we are not investing enough in science. We need to re-inspire a whole new generation of Nigerians to pick up science, because it's only by studying these things, understanding what they work, how they work, what their effect is, that we can actually say that that agbo is actually what is making you safe at the end of the day. So I want really to see young people come into science, push our universities. Let's continuously develop a whole new way of life. There are no easy solutions to these things. People talk about vaccines, hydroxychloroquine. You know, there are no simple solutions. We've got to demonstrate scientifically that they work. And we can do this collectively if we refocus our energies in building the scientists for the future. I want to see at the next opportunity to recruit forensics a whole lot of Nigerians that are interested in science and want to contribute to building a great institution at NCC and all the other health institutions across the country.
Thank you so much, Dr. Chikwe Iheakwazu. I really appreciate your time this morning, and good seeing you again. Thank you so much.
Thank you very much. And please keep up the great work you're doing at the AIT.
Thank you, sir. Right, that's Dr. Chikwe Iheakwazu, Director General, Nigeria Center for Disease and Control, joined us as we appraise the journey so far. 33 weeks into this pandemic, how far have we been able to go in our containment measures? Of course, we'll take a quick break to allow us our second guest join us here physically in the studio. Dr. Nikez Ndembi is a director of Laboratory Research, Institute of Human Virology of Nigeria. He's a virologist and a public health expert with lots of experience. He'll be joining us physically here after this break.